Well, hello, everybody, and welcome back. My name is Lisa Hughes, and I am your host tonight. I am one of the co-founders of the Fire Tribe, and tonight we have a very special guest who is returning for part 2 of our series with her. This is Dr. Traci Patterson. She is going to be going over tonight how her philosophy on treating CRPS, which I know many of you are eager to hear about, especially after our last segment with her where she spoke about her own journey and finding remission with CRPS. So as without further ado, I'm going to bring on Dr. Traci with us. There we go. Welcome.
Hey, thank you. Thanks for having me back. It's a pleasure to kind of jump on in here and add into my personal story and talk a little bit about what we do and why we do it.
Awesome. Well, the floor is yours.
Awesome. Well, for those of you that missed the last call, let me just briefly introduce myself, and that'll give us a better idea of kind of where we're going with this. So for myself, I was diagnosed with CRPS. It started in left foot and ankle in a nutshell. And over the next 7 years, it spread. And I think that is a common segment that we hear through a lot of people. So, being able to look at, what is working, what is not working, and then being able to make a difference. So for me, CRPS started in that left foot and ankle. The first 4.5 years were all traditional medicine. And when that happened, my CRPS got worse after 2 spinal cord stimulators. And that's not saying that that's what's going to happen with everyone. But for me, that is what happened. And when my last spinal cord stimulator was taken out, then at that point, I started traveling the world to get my life back. And ultimately, it was integrative and holistic medicine that helped me do that. And that was a jumping off point to what we do today. So hopefully that gives you a little bit of background for those of you that missed our first segment. And now let's kind of jump in a little bit more into what we do. I just want to talk to you about CRPS and our approach. So again, my name is Traci, Dr. Traci Patterson, and I am the president of Holistic Center Treatment and also the founder of the HCT Foundation. So first and foremost, I think it's so important to hear that I'm a CRPS survivor just like all of you are. And that's a really important piece here. I also created the CRPS Hub, which is out there as a tool for those people that are diagnosed with CRPS or those individuals that their family members or practitioners need to have additional information. I've published a book about my own journey called Stepping Outside the Box, A Journey from Invisible Pain to Invincible Living. And it's not a technical medical book on CRPS, but instead trying to walk you through my own journey so hopefully you won't feel alone, and also so other people will have a better understanding of what we go through as a CRPS patient. So for those people that might be newly diagnosed, let's talk about the who, what, where, and when as far as CRPS, and just real briefly. So for those of you that are living with CRPS, just bear with me for about 2 minutes, because those people that are newly diagnosed really need this piece of information. And we all know that CRPS is classified as a rare incurable diagnosis. There's approximately 200,000 individuals diagnosed every year, according to statistics in the United States alone. And it's chronic pain. It's rated higher on the McGill pain scale than natural childbirth, some burn victims, and even amputation of a digit, meaning a finger or a toe. And CRPS can start anywhere in the body. It can start from a strain, a sprain, a surgery. I had one young lady that unfortunately started after mosquito bites, another individual that started for no reason at all, and another individual after a bee sting. So the reality is CRPS can happen at any time, in any place, with or without cause. So it's also important to know that. As far as CRPS, it's a dysfunction in the nervous system. My perspective is it's the perfect storm in the brain. So a lot of times there's been a drop in the immune system. If we look at 30, 60, 90 days out, somebody's had an injury, an incident, something that's happened, and then there's a lot of stress right around that time. And that creates this perfect storm in the brain where all of a sudden our brain is sending out the wrong signal. And I think that's important to look at. CRPS is persistent, debilitating pain. So for some people, it's a sharp, stabbing, burning pain. For other people, they talk about a deep ache. So it's going to be different from person to person. And even though everyone says there's no cure, and there is not, it is possible to either manage it at a low pain level or to gain long-term remission. And we'll talk about that as we go through also. So what are some of the causes of CRPS? And to be honest with you, CRPS is completely still misunderstood even in 2024. There's simply not enough research, statistical information that we can disseminate or look through to really understand the ins and outs of CRPS and why person A gets CRPS and person B is perfectly fine with the same injury. But CRPS is thought to be caused by an injury or something that goes on that affects the peripheral and also the central nervous system. So again, think about that perfect storm in the brain that I just mentioned that also ties into our immune system and also how our central nervous system and our autonomic nervous system respond. So what are some of the symptoms? Burning, stinging, pins and needles, sensitivity to hot or cold, our body simply not regulating, swelling, changes in skin temperature, it can be sweaty, it can be cold at times, even changes in skin texture. It can be thin or shining skin. For some people, excessive hair growth or the hair stops growing, nail changes, joint stiffness. For some people, what they call dystonia, which is tremors or muscle spasms, atrophy of muscles, and even reduced mobility in that affected area. And a lot of that, as far as reduced mobility, can also tie into those pain levels. When we look at CRPS and when we start down that road of CRPS, how is it treated? We go to our doc, then they send us to a neurologist, and then we're off to a pain management doc. For some people, they'll see 10 doctors, some people 100 doctors before they get a diagnosis. So when we're diagnosed, it starts with evaluating us, looking at a Budapest criteria, deciding do we have the signs and symptoms of CRPS. Then most pain management doctors are going to talk to us about physical or occupational therapy, get us moving. Medications, it can be anti-inflammatories, antidepressants, lyric and gabapentin, Neurontin, those are all the newbies that everybody is getting. For some people, muscle relaxants, and other people, opiates. Then they also talk to us about blocks, sympathetic blocks or stellate blocks if it's upper extremity. Some physicians are now starting to talk to their patients about nerve ablation, meaning cutting, cauterizing the end of the nerve or killing it. Spinal cord stimulators, neurostimulation, also DRG stimulators, and even for some pain pumps. But what's the problem with all of that? I think anybody currently living with CRPS already knows the answer. And that is most CRPS patients are not getting relief with these traditional treatments. As a matter of fact, myself included, a lot of us get worse with these treatments. Just treating the symptoms isn't working because CRPS is not a sprain, it's not a strain, and it's not the fracture. Because our body will heal in 6 to 8 weeks following all of these. But CRPS surpasses that initial injury and that healing process, so it has to be treated with a different approach. Because CRPS is more than just the pain. And don't get me wrong, the pain is horrific. But it affects us physically, mentally, emotionally, spiritually. It affects our relationship. It's isolating, and that list goes on and on. So our perspective as someone who has lived with CRPS, and to my knowledge, we are one of the only programs put together by somebody who has actually been through CRPS and gotten into remission. So I believe in treating the whole person, because to effectively treat CRPS, we have to look at you as a whole, because treating the symptoms simply isn't working. So this means individualizing a treatment to each person we work with and addressing all aspects of CRPS and also coexisting diagnosis, so physically, mentally, emotionally, spiritually. And this is how you're going to see forward progress. So treating the whole person means to me in our program addressing fight or flight, because that is your sympathetic overload that ties back into your autonomic system. Working with the vagus nerve, because that ties into your parasympathetic side, makes it easier to balance your autonomic nervous system. That alone will start dropping your pain levels. Then we can break the pain loop. We can address coexisting conditions. We can help you with reducing and managing stress and anxiety, even depression. We can't control, but we can manage. Increasing restorative sleep, because that's when our body heals. Increasing an overall sense of well-being, and providing individuals with the tools and the resources to be able to have those long-term outcomes. And everybody hears me talking about this, whether they're in office, whether they are doing a consult or just having a general conversation with me. We are as individualized as our fingerprint. Therefore, you have to have a treatment that's individualized to meet your specific needs and goals. So we've got to really start looking at the things that are going to make a difference. Being able to put things in perspective so that we can make that bigger difference, so that we can help our body get back to where it needs to be. The bottom line is the brain. And it's responsible for all of body's functions. It controls every aspect of our body, from temperature to blood pressure to our heart rate to our breathing. And our brain ties in to our autonomic system. And that is why it is so important to look at all of these aspects so that you can make the changes, or your body can make the changes. So when we start talking about that perfect storm in the brain, that's how we're going to address it, is by being able to address this central nervous system and your autonomic nervous system. So with CRPS, your fight or flight, or that sympathetic overload, is your driver. It's your mechanism. And that's why it's so important to address that. Because so many people out there are doing ketamine and they get short-term relief, but it's not working long-term because they're not addressing fight or flight. For some people with Calmare Scrambler therapy, they're having amazing results, but it's not lasting long-term because, again, they're not addressing that fight or flight, and it goes hand in hand with so many different things. So your autonomic nervous system is simply the part of your body that automatically runs everything that we don't have to think about. And that's the simplest way of thinking about it and looking at it. So fight or flight, when we're in fight or flight, our sympathetic's up here, like in the clouds, and our parasympathetic is down in the ditch. So when we can balance our nervous system, that allows our pain levels to come down. That's what's going to ultimately allow your body to start healing, and that is what's so important. Now, I mentioned the vagus nerve, and the vagus nerve is coming up more and more with a lot of different programs that are out there. So your vagus nerve is your 10th cranial, and it's really important because it is tied into your parasympathetic side of your autonomic system. It controls inflammation in the body, GI function, immune function, and that's just a few things to name. So our autonomic nervous system is divided into the two parts, your sympathetic and your parasympathetic, and they're meant to be balanced. But just like weights and balances, it can go up and down. It's about managing our response to stress, and that's going to help us. By working with your vagus nerve, it allows you to start tapping in to your parasympathetic side, and that's also a key part of this. And then looking at the brain. That brain-pain connection, because there are certain functions that the brain's not going to allow to happen. So we can't be relaxed and up here in fight or flight. We can't be hungry and nauseated. So when we start understanding the basic anatomy and physiology of the human body, and we start digging into the brain, we're going to be able to move forward and get more people across the finish line, but at the same time, get closer to a cure, because it's the brain, in my opinion, that holds the keys to the kingdom. But getting that individual out of fight or flight is starting to then balance your autonomic system. And that's when our body can heal, because when it's not in balance, when we're stuck up here in fight or flight, that's when other dominoes can start being triggered. So the longer we're dealing with CRPS, the longer we're in fight or flight, that's when people are going to say, my eyesight's getting worse. I'm having stomach issues. I'm having GI issues. I've been diagnosed with gastroparesis. I am having heart palpitations, and I've been to the cardiologist, and they can't figure out what's going on. And that's why it's so important to balance your autonomic system. Then another piece of it is neuroplasticity, and that's like the brain's superpower. The neuroplasticity is the amazing ability of our brain to be able to kind of rewire itself, to adapt to new situations, to learn new skills, to recover from damage, and even create new neurons in areas. Our brain is always transitioning. It is not fixed, it's dynamic, and it's always learning, it's always adapting. So here's a really simple analogy for neuroplasticity. For those of you that are old enough to remember, what is a filing cabinet drawer? Think about a filing cabinet drawer, and every single thing that we have learned in life, we learn through repetition. And when we learn it, our brain creates a file folder, and it goes into our filing cabinet. So the older we are, or the more experiences we have, the bigger our filing cabinet drawer. But our brain learns the good things like riding a bike, driving a car, using a computer. At the same time, it can learn CRPS. But we have the ability to actively work with neuroplasticity and essentially reshuffle your filing cabinet drawer. And that is going to help us as we move forward when we start talking about CRPS. Our approach at Holistic Center Treatment is a 360-degree individualized approach to treating CRPS, but also individualizing it to each person that we work with. So we have a multimodality protocol, and I'm going to be honest, our protocol is always changing and evolving. Someone that saw me 4 years ago, 5 years ago, 7 years ago, 8 years ago, it was a different program back then than it is now, because I am on this bandwagon to try and find a cure for CRPS or to get as many people across that finish line as I can possibly get. So that is going to mean evolving and changing the program. But currently, we work with laser, low-level light therapy. Also, our particular machine is not just an on and off switch. We have the ability to change duration, to change energy levels. And we have different diodes or probes, which means that we have the ability to decrease inflammation, to increase blood flow, which increases your healing. We can break up scar tissue non-invasively. We can also calm down nerve pain. So that's just one modality alone. And then we also have PEMF. So PEMF allows us to also decrease inflammation and promote healing even down to the cellular level. We just talked about neuroplasticity, so being able to work with the individual to help their brain rewire itself. We work with biofeedback through heart rate variability, and biofeedback in and of itself, I say this all the time, is not going to cure or fix CRPS, but it's a piece of our puzzle, because when we can manage our heart rate, we can then manage stressors and triggers that will push us back into fight or flight. And our heart rate is connected to every single thing in our body. That's why when we go to the doctor and our pain level's up, and all of a sudden they check our heart rate, they check our blood pressure, they're like, Mr. or Mrs. Jones, your blood pressure is really high today. No kidding, our pain levels are high. So when our pain levels go up, our blood pressure goes up, our heart rate goes up. When we are stressed, when we are anxious, the same thing. Even when we overthink, the same thing happens. And that's where working with heart rate variability can be a piece of your puzzle. Working with neurofeedback, the ability to see what's going on with our brain and to start making changes. Microcurrent, again, promotes healing, decreases inflammation. We do work with clinical hypnosis. For those people that are open to it, think of this as a guided meditation where we can get into a relaxed state. Keep in mind, your brain will not allow you to be relaxed and in fight or flight. And with hypnosis is a guided meditation with positive suggestions, but also using your own visualizations of times when you felt well, you felt happy. And that also helps with neuroplasticity. Yes, we teach breath work. Yes, we work with a program that allows us to work with left brain or right brain. We have an EMDR therapist on board, so that's eye movement, desensitization, and reprocessing. So that helps with the emotional charge that we have tied to things that we've been through, whether we want to call it PTSD or trauma. For me personally, after 7 years of CRPS, I had medical PTSD, and I think a lot of people with CRPS are going to agree with that. Working with the vagus nerve, again, tying into that parasympathetic side, and also doing brain training, helping our brain to get in specific brainwave patterns that is going to help our body to heal. Now, based upon the person that we're working with and what they need, we will take these pieces of our puzzle, and that's where we're going to individualize it to them. So our program is a 2-week outpatient located here in Boise, Idaho, followed by a 90-day home program. And a lot of people that have done multiple days or weeks of ketamine, CalMare, different treatment programs all over the world are going to say 2 weeks. How do you do this in 2 weeks? It's called an intensive for a reason. So people are with us approximately 5 hours a day, Monday through Friday for 2 weeks. And that is the equivalent of doing 2 to 3 months of treatment at other programs. So the reality is you're not sitting in a waiting room. You're given a private room when you come in. You're treated as a guest, not a patient, and you are our guide. You know what you're feeling, and your feedback is then translated into what we do and how we do it. There are no hidden fees, and as a matter of fact, for those people coming in from out of state, we also have a list of Airbnbs and hotels in the local area. I think one of the big things that I really want to put out there is someone that's lived with CRPS is I don't agree with a lot of the analogies that are out there. We don't have to cause pain to be able to heal. As a matter of fact, when we start talking about fight or flight, when we cause pain, we are actually pushing the body further into fight or flight. And that is the last thing that you want to do. You need to be able to help your body calm down. You need to be able to help your body get out of fight or flight, and that is how your body can heal. So our goal is to help you regain your life, to reach your goals, and then give you the tools and the resources that you need at home to live a productive life. And let me just give you a couple, like 2 or 3 people that have been through our program. Sierra went through my program well over 5 years ago. It's actually probably been closer to 7 years ago. She had CRPS from her hip down to her toes on the right side. And as she said in this testimonial that she sent in to me, for the most part, she considers herself in remission. She says that she has a couple of days where she'll have some weird feelings, but it's not her normal CRPS pain. She's been able to get back to yoga. She's actually a yoga instructor. She works full-time in aerospace. In addition to that, her husband and she travel. She hikes, she snowboards. She's out at the beach all the time. She's doing really, really well. Another person that we saw when she was diagnosed, she was 15. She's now graduating from high school with honors, and she is doing amazing. At this point, she is back to showing horses, living her life. You know, prior to coming, she went through Randall Children's Hospital's intensive PT and OT program, and she was able to get down to a 2 out of 10, but it didn't hold. So through our program, she was able to get down to that 0 pain level. She is graduating with honors, as a matter of fact, here any day, and doing absolutely amazing, and I am so proud of her. And here's another person, Kathy. She had CRPS in her hand and her wrist, and it actually had moved up to her shoulder, where she ended up with a frozen shoulder. And she had been living with CRPS for quite a while. Following her 2-week intensive, she was down at a 1 out of 10, and when she got to the 90-day home program, she actually ended up at a 0 pain level, and she's been able to regain full movement in her hand and regain her life and do the things that she wants to do. And I think that those are really important things to hear. Now, before we kind of take questions and jump in a little bit further, let me tell you a little bit about some of the life lessons that I personally learned with CRPS. First, CRPS is a diagnosis that is going to rock our foundation. in anyone's world and take the wind out of their sails. It is a diagnosis that most of us don't even know about. Most of us have never heard about. Most of our physicians are not knowledgeable in it. And that's what it felt like to me when I was diagnosed. My head was spinning, and I was like, in this day and age, how can there be a rare incurable disease? It's something that no one ever wants to hear, and when you do, your heart skips a beat and you feel like you're in a movie. And it's not a happy movie, it's a horror show. And then you realize all of a sudden, wow, this is real. And at that point, your physicians are also telling you that this is a rare incurable disease. Even my pain management doctor reiterated to me, there isn't a cure. And it's a journey, and CRPS has proven to teach me patience. It's also unlocked doors as I've moved forward. It's changed me physically and mentally, even emotionally, and made me have a different outlook on life. But I also believe that knowledge is power, and that's why I wanted to kind of come on here with Fire Tribe and share a little bit about my background, share a little bit about my own journey, but also other treatment options that are out there. My own pain management doctor insisted that there was nothing else he could do except medications, sympathetic blocks, and spinal cord stimulators, and I did 2 of those. I don't know if physicians say that because they're afraid to be held liable for alternative or holistic treatments that are out there. Maybe they're just not aware of them, or they don't want to legitimize them. I have absolutely no idea. But I want you to know that there are plenty of people all over the world that have sought treatment, not only from me, but other programs in different areas of the U.S. and different countries. And they've been able to get the help that they need to manage CRPS, and for a lot of people to get in remission. Don't believe what everybody says, because everybody is different. I've been in remission for 10 and a half years, and I have a long laundry list of individuals that have been through our program that are also in remission. We also have individuals that are just managing their CRPS at a lower pain level. But it's also important to accept support, accept help, and embrace your family if they're there to help you. Not all of us have family that is. Our friends, our neighbors, maybe colleagues. It's also important to stay connected with other people to the best of your ability. And I know CRPS is heart-wrenching. It flips our world upside down and then some. But CRPS also has a way of showing us who are our true friends. The ones that are sticking by our side through thick and thin, the ups and downs, the twists and turns, the good and the bad. Keep those friends around and stay in touch with them. Let them be a support structure for you. And then also celebrate the little wins, the little things, and don't be afraid to do that. In different life lessons that we all learn, when you can finally get on the other side of it, you're going to have a different viewpoint. You're going to be stronger. There's so many things that will change in your life. But it's important to take that first step. If the same old thing is not working, then it's time to take a different adage, and don't be afraid to step outside of that box. I want to provide you hope. I want to give you help. I want to share a simple message that, in my opinion, patients with CRPS, they don't have to suffer in silence and through the cries of agony that I'll never forget. Traditional medicine may not have all of the answers for us, but the reality is it's so important to know that you have treatment options out there. You have things out there that can help you move forward. And again, knowledge is power. If we can advocate, if we can share knowledge of what's working and what's not working, if you do a program, whether it's medication, whether it's physical occupational therapy, whether it's ketamine, whether it's CalMare, whether it's a different program, go back and share with your physicians what's working and what's not working. That is the only way that they're going to be able to make a bigger difference with other patients that are suffering just like we do. So hopefully that's given you some information that's on there, and I am happy to splice in additional information to answer any questions that you may have, or to share more if there are specific details you want. So, let's open this up to Alyssa and see if there's any specific questions out there. So if you've got any questions, just know that, I'm definitely here to answer them. And I know that there's always questions and people always want to compare programs. I think the big thing to understand is that there is not one program out there that has a cure. And if someone tells you they've got a cure, I'm going to tell you to run for the hills. I think there's a lot of people that are working in the right direction. There are a lot of programs that are trying to put the right pieces in place. But ultimately, listen to your gut, listen to your heart, and figure out what's going to work for you. There are some people that I talk to that spinal cord stimulators have given them the ability to live their life. And for those people, I'm going to say high five, and I am so glad that you found something that worked for you. For me personally, spinal cord stimulators made me worse, and it caused my CRPS to spread. And unfortunately, that can be an adverse risk that is out there. So for me personally, it didn't work. For some people, they swear by ketamine, and they say that, ketamine is their go-to. And if that works for them, that is awesome. But find what works for you. And again, knowledge is power. The more you can learn about CRPS, the more knowledge you have in regards to different treatment programs that are out there, the more that you're going to be able to kind of disseminate and figure out what works for you. And I think there was a question up here about somebody went through a mainstream program, they used microcurrent. I've had people that have gone through other programs, and I've had other people that have said, I've done this piece of your program over here, I've done this piece over there, but I've not necessarily done everything together. So we do have individuals that are using frequency-specific microcurrent. Other programs are using general microcurrent. Other programs have a specific way that they want to use it. So for us individuals that have tried microcurrent at other program and then come into our program, for whatever reason, feel that it is effective and it is helpful. But that is simply one piece of multiple pieces that we put together. So that piece of microcurrent falls under the modalities that we're doing to decrease inflammation and promote physical healing in the body. But it's not that modality alone that's going to get somebody into remission. And that's what people have to understand. To be able to get into remission or to be able to manage CRPS at a lower pain level, you really have to address fight or flight. You have to address your autonomic system, and then you need to have tools and resources that are going to help you manage that long term. So for me, I'll use myself as an example. I've been in remission for a little over 10 and a half years. Remission, my definition is zero pain levels, zero flares, living my life, doing what I want to do. And yes, over the last 10 and a half years, I have sprained both ankles. I had a mountain biking accident where I broke 3 ribs. I've had other accidents, strains, and sprains where I've managed the fight or flight response, and my CRPS did not come back. I practice what I preach. Every single day, I do something so that if I'm up in fight or flight, I'm managing my response and I'm getting myself out of fight or flight. That is your driver, and that is your mechanism when it comes to CRPS. So that is a piece that people have to be willing to put into place to be able to have those outcomes that you're looking for. There are probably other questions. People have done laser at other programs. They've gone into different programs where they had a main emphasis on laser, for example, or low-level light therapy. But I think the big things that we're up front with here is, one, low-level light therapy and or laser will not go through clothing. So the reality is, if you've been to an office, you've been to a program where they are looking at saying, oh, we're using a laser, but they're not asking you to pull up a pant, pull up a sleeve, or they're not having direct access to your skin, you're really not going to get benefit from it. And even with microcurrent, if we look at that piece alone, again, you don't have to cause pain to promote healing. And that's where I am a little OCD with that piece, just because of my own personal journey and the different things that I went through that were so painful. In anybody, in every single human body, if you cause pain, even someone that does not have chronic pain or CRPS, when we cause pain, you just push the body into fight or flight. So when we're trying to calm down your autonomic system, if you're doing a treatment or a modality that is pushing those limits and causing a flare and causing your pain levels to skyrocket, you're going in the wrong direction. And I cannot emphasize that enough. It's so important to hear that and to understand that. Any other questions that are coming up, or people, that you may have? I think the big thing to understand is, for our office, we always do free consults. And if someone calls and they've got questions, they reach out through our website or even through email, there's never an obligation. Knowledge is power. The more I can share information, whether it's about my own personal journey, whether it's about our program, whether it's about a specific modality, the further off we're all going to be as a community, and being able to support each other and to be able to put the pieces in place that are going to help us move forward. So I always encourage people to reach out, whether you're a family member, whether you're the individual going through it, whether you're a parent, whether you're a distant relative that's happened before too. Reach out, set up a free consult. We do telephone consults, Zoom consults, telehealth. We can set up a consult where we can answer questions, get on, even a virtual call to be able to provide that information. Then if somebody feels that it's a right program for them or they want to take that next step, awesome. But there's never an obligation and there's never a charge to be able to gather that information and to be able to get the information that you need to make that decision. So hopefully that's answered a few of your questions. And I would say if there's anything else that you feel really, needs to be addressed, or you've got any other questions, reach out to our office. My book is also out there called Stepping Outside the Box, a journey from invisible pain to invincible living. It's on Amazon. It's also available on Kindle. So that book is definitely out there. We also have the HCT Foundation, which is our new nonprofit foundation. So as we move forward, be able to start raising funds to offer partial grants and scholarships, and over the next couple of years actually be able to use that foundation so that we can start doing research and seeing more viable treatment options that are out there. So if you want additional information, please visit our website at www.holisticcenteredtreatment.com. You can also call our office at 844-994-0999. I see another question came up, or a comment. Yes, we've seen individuals that have come in wheelchairs. I've seen individuals that have CRPS on one extremity. We have other individuals that have CRPS, unfortunately, full body. We've had individuals come in with just a couple of diagnoses, meaning CRPS and one or two coexisting diagnoses. I've had individuals come in with more than 12 diagnoses. It's really about individualizing that person. And no, if someone is coming in a wheelchair, in that 2 weeks, we don't have time to do physical therapy. It's more about giving you a really, really good foundation where we can start getting you out of fight or flight and dropping your pain levels. And then typically when you get home, part of someone's 90-day home program, especially if they've not been walking, they're in a wheelchair, they're 100% non-weight bearing. When you get home and you've dropped your pain levels, that's the point in time that we're going to ask you to revisit physical therapy or occupational therapy or rehabilitation in general to start working on strength and stamina and range of motion. Because when our pain levels drop, you can actually get more out of physical therapy. Because when our pain levels are 8, 9, or a 10, our muscles are guarding. And when they're guarding, that actually can cause more pain. And then we're not going to get as much out of physical therapy. So there is a rhyme and reason. And I know for some people it seems backwards because we're told, especially with pediatric pain programs, their philosophy is no pain, no gain. Push through it, push harder, harder, harder. And it's not about dropping pain levels. It's about getting our kids more functionable. And unfortunately, even some of the adult inpatient programs are very similar. They have pain psychologists telling them, when you learn to accept that this is your new life, then you'll be able to move forward. I disagree with that wholeheartedly. And I really want people to understand that there is hope and there are resources. Someone else asked, why there isn't research being done in the U.S. There is some research that's coming up periodically. Cleveland Clinic has done research. I've not seen the outcomes yet. They did research a couple of years ago on laughing gas or nitrous oxide as it related to CRPS. I've not been able to see the outcomes yet, and I've been looking for that because I know that there's a hospital out of London outside of London that is using laughing gas or nitrous prior to what they call physio or physical therapy or occupational therapy, because patients aren't tensing, they're not, your body's not guarding, so they can get more out of it, and then they're not left with massive flare afterwards. But I've not seen any outcomes on that specific to treating CRPS long term, and I don't think it's going to long term. I know that Cleveland Clinic also I think they currently are undergoing another research project as it relates to stem cells, but that's brand new, and I've not heard their criteria or anything else that's going on. So there is some research being done in the United States, but it's all tied into big pharma. It's all tied into, the drug companies, because that's where the money is. And that's where we need more information. Dr. Goebel out of the UK is doing amazing research on genetics and a lot of different things, trying to see, is there a genetic component? But we simply don't have that information yet. So, I hope that kind of answers that question a little bit too.
Awesome. Thank you. Thank you for touching on all of that. I definitely know that. I think you gave some information today that we know folks were interested in learning more about. And now you also, I believe on your YouTube, you have a blueprint of treating CRPS, right? So if they need some graphics, they can reference it.
Absolutely. So if you go on to YouTube, just about every talk that we've done that's been recorded will tag in there. But one of the better talks that we did April of last year was a blueprint to effectively treating and conquering CRPS. And that went into a lot of detail. And I didn't want to go into that much detail today because for some people it's just overwhelming. Other people, we don't have the attention span when we're dealing with CRPS because of brain fog and chronic fatigue and everything else that goes with it. So for me, my adage today was, let's just share some information. And, just like you said, we do have a video out there, and it's also, I think, tied into our website. If you look on videos under our website, it's on there too. So it's a blueprint to effectively treating and conquering CRPS. It talks more in depth about traditional treatments. It talks more in depth about every single modality that we use and why we use it, and then how it comes together. So that's always out there for people too.
Is there any other resources that you would suggest, maybe for some of the parents, or
well, I know that they're
probably the best bet is just to get on a call with you and chat.
Yeah, so if people are just wanting to either pick my brain or look at what are we doing in comparison to other places that they've talked to or other programs that maybe they physically have been to, I'm going to encourage them to reach out, and that's going to allow me to be a better resource for them. And again, there's never an obligation to come through our program. For those that have children dealing with CRPS, a really good nonprofit that's tied into that is Ferocious Fighters. Not meaning to name drop, but the reality is it was started by Patrick. He lives with CRPS. He's been a massive advocate for CRPS patients, and they actually help support through cards and different things that they send out and blankets. They support so many young people, teens and tweens around the world. And from my understanding, they also have some amazing chat groups that are monitored for them to be able to get on there and say, I'm just having a hard day. And for the other kids that also have CRPS to actually support them and lift them up rather than dragging them down. So I think, Ferocious Fighters is an amazing resource that's out there for support for both families and also children that are living with CRPS and teenagers. So there's so many resources that are out there. Find your way. But again, we never charge for a consultation, and there have been times that I've been on the phone for 20 minutes, more times than not, it's an hour. I've been on the phone sometimes with people for 2 hours, just answering questions and trying to help provide that information, because again, knowledge is power. So the more we can advocate, the more we can share what's working and what's not working, the better off we are, both as individuals and as a community. But I can't reinforce enough that when you're going through this, and I see this so often with us as an adult, when we're managing CRPS at a low pain level, we get into remission, we don't want to look back. Mm-hmm. So all of a sudden we jump off the boards, which is fine, but we're also not sharing with our physicians and our medical team what really worked for us. And if we don't share what worked and what didn't work, then we're actually doing a disservice to other patients that are coming behind us. Now, on the flip side, when I've got kids that their parents go through the program with them, the parents are the best cheerleaders, and they're still getting on the boards. They're still sharing information with other parents saying, hey, this worked for us, this didn't work for us, or it was this combination that worked. That's what's going to help other people move forward. I understand, because a lot of the support groups that are out there are really negative Nancy's, and, everything is negative, and then that pulls us down. But don't be afraid to share the information. Don't be afraid to put out there what's working and what's not working. It's okay to share our stories and be realistic and, providing that information.
Yeah, I know that's something I've tried to do as I've slowly worked through my own medical trauma. As I've gone back to providers slowly, they're like, wow, you look great, what'd you do? And I've slowly been sharing with them, but it's definitely something I know that it's a really good point. I mean, I don't think a lot of us think about that in that way. So.
And we don't. And even for me, my neurologist was the key person. She was like my kingpin that got me diagnosed so early. I was so fortunate compared to other people because she suspected it right after the surgery. She's the one who opened the door to my pain management doc. She's the one who opened the door to the ortho who did my 2 reconstructive surgeries, even with CRPS. But then I lost touch with her, and I had been in remission for about a year, and I happened to be in the same medical building she was in, and I thought, you know what? I don't think she knows. So I popped into her office unannounced, and she kind of poked her head around the corner, and she's like, is that you? Like, there's no crutches, there's no cane. You have clothes on, you have a sock on, you have a shoe on. And she literally apologized to her other patients in front of me and said, I'm sorry, we're going to run a little bit behind, and pulled me into her office because she's like, I don't get to see patients in remission. And she was flabbergasted. So we had a really good talk. Then we set up a time for me to come back and spend more time with her. If I wouldn't have done that on a whim, she would have never known. And now she had the information to be able to help so many other patients.
Yeah, wow. That's a great story. That's wonderful. Nice full circle moment, I'm sure. So for any of our other viewers that are here, are watching the replay, please feel free to drop any questions into the comments. But again, like Dr. Traci said, you can always reach out to her personally and ask those questions if you have them. So unless there's anything else you can think of that you want to add for tonight?
I think we're good. Again, if someone's going through CRPS and you feel like you're alone, you're not. I think that's the biggest thing that I can say. And for the parents, the caretakers, the spouses, the family members, you're not alone. There's so many tools and resources, and I know it's hard to find them. But don't be afraid to look. Don't be afraid to search. But more importantly, listen to your gut. So you can always contact our office. We even, answer phone after hours, and I return emails. Some people are surprised that it's the middle of the weekend and I'm returning an email or a phone call. Contact us. It's 844-994-0999 or holisticcentertreatment.com. My book is an amazing resource for those people that don't think that someone else has really been through what they've been through. Again, it's not a technical book on CRPS. It's about my journey. and trying to open the door so other people realize, oh my gosh, I'm not the only one that's been through this. And also for family members to have better insight that it's not just that family member, that there are other people going through CRPS that have a very similar journey. And I think as people compare their journeys, they see so many similarities, and that helps empower us. That helps us to understand it's not just us. And, more than anything else, I'm sitting in front of you pain-free for over 10 years. And if I can do it with my crazy story, you can do it. And I think that's the big thing, whether it's managing CRPS at a lower level or whether it's remission. Either one are amazing to be able to get back to our life and to be able to get back to doing the things that we want to do. So never give up hope, and always know that you've got resources and people that are willing to listen.
Thank you so much. And for those who are watching, just so you know, all of the information for Dr. Traci is in the description above or below, depending on where you're tuning in from. So you can find that there. But again, thank you, Dr. Traci, for coming on, and thank you, everybody, for joining us tonight. It was great to have some of you folks participating, asking questions, and giving us feedback. We always appreciate that. So thank you again, and everybody have a wonderful night. And thank you again, Dr. Traci.
Thank you.